participating. Yes, as usual, when I read something new, I always like to start sharing with the people. So I, for last about a month or so, I was reading about neurophysiology of mindfulness, and I found it to be very interesting for me. And I thought, let me share with all of you some of those thoughts. Uh, one
Yeah,
thing, one thing I realized um, while preparing on neurophysiology of mindfulness, that many medical medical professionals who are joining this hypnosis diploma course, either in Baroda University or Charuset, most of the medical professionals, they tell me after several years when they meet me that, sir, we are not using hypnotherapy in our practice, but we do insist our clients that they should do breathe awareness. That breathing awareness हम लोग कराते ही है, हम खुद भी करते हैं हमारे लिए, and to most of our clients, our patients, we suggest for doing that. और आपका recording दे देते हैं, हम करवाते भी नहीं है, but we give your recording of breathing awareness. और उससे काफी बेनिफिट मिलता है. एवरी टाइप ऑफ पेशेंट में हमने देखा है कि काफी उससे बेनिफिट मिलता है. Many medical professionals have been telling me this, and I used to wonder that how it just this simple first step what we are learning can help so much to all different people. But as I was preparing for this talk, then I understood that yes, only this can also contribute a lot in almost everybody's life, especially those who are suffering from physical or mental ailments, any kind of ailment. Sorry, आज मेरा throat थोड़ा difficulty दे रहा है, but anyway, I'll manage. So let us begin. I'll share the PPT. Okay. So what I mean here is that we are going to see correlates, neurological correlates of two things. One is a process of mindfulness meditation, and second, neurological correlates of benefits of practicing mindfulness. So I was trying to convey this by using these words in different sequences, and ultimately I have given this name, but I don't know whether it clarifies that or not. So we are going to discuss process of mindfulness meditation first, and then benefits of practicing mindfulness meditation. But in both these, what I want to emphasize on is neurological correlates of both these things. And you know, this is the philosophy on which we work at Samathom. We are blessed with the tools. Let's cow ourselves, our body, mind, and intellect. If we use these three divine means for the right purpose in the right way, we can certainly cow ourselves. Now, when we look at the Ashtanga Yoga, this is where I am trained for this Ashtanga Yoga, and I have been a yoga teacher in that institute also since 92. So, if we look at meditation in Ashtanga Yoga, it is step number 7, eightfold or eight limb system. It is the seventh limb or seventh step, you can say. But then the training, the practice of dhyana would include pratyahara and dharana, both. Pratyahara means training the sense organs to withdraw from external objects. So ये चक्षुन इंद्रिय जो बाहर के दृश्य को देखती है उनको अंदर की ओर मोड़ना. And I have simplified the meaning of it in my way that when we do some visual imagination or auditory imagination, the sense organs are turned inward, and that can be called pratyahara. There are no scene in front of me, but my eyes are closed, but I'm seeing some scenes in my mind. So that can be called pratyahara. So this way, inward focusing and withdrawing them from the external object. Dharana is training the mind to maintain single-pointed focus. One thought or one feeling, one sensation. We train the mind to focus there consistently. So there is an effort here. While when these two steps person is doing regularly, it culminates in dhyana. Dhyana, that is meditative state, it is effortlessly maintained, uninterrupted, unidirectional flow of mind. So there is no effort. They say तैल धारावत. तेल की धारा जैसे जाती है, इससे तैल धारावत, uninterrupted, unidirectional flow of mental processing. So in Ashtanga Yoga, I learned it this way that there are these three steps. They culminate in the experience of or practice of meditation, dhyana. There are several popular meditations like mindfulness, mantra meditation, japa meditation, Zen, transcendental meditation, Raj Yoga. So we are focusing on this, but many of the things are applicable to most of the different techniques of my meditation. More than 2,500 years ago, Gautam the Buddha stated that mindfulness meditation is the true key to the liberation, to enlightenment. What is it, mindfulness? The awareness that emerges through paying attention. It is the awareness which emerges by paying attention on purpose, purposefully paying attention in the present moment and non-judgmentally to the unfolding of experience moment by moment. So the experience which is unfolding moment by moment, we non-judgmentally just pay attention, remain aware of. So deliberately, on purpose, paying attention to the present moment and non-judgmentally being aware of or paying attention to unfolding of experience moment by moment. Or it's an art of being an observer of the present moment without any judgment. That is how many different people define it. Neurological tools which are used in the research on this meditation is neurological correlates of meditation. Um, One of them is electroencephalography, EEG. EEG provide excellent temporal resolution, but it is poor in spatial resolution. See, temporal and spatial word, you must be knowing temporal means one by one. So it in brain, um, one impulse, then next impulse, then next impulse, and then sequences of impulses or stimuli, they accumulate and they create some activity. So that is temporal. Temporal means one by one. And spatial means at a time. Many signals coming at a time together. And then what happens, that is spatial. So EEG will provide excellent temporal resolution. What happens one after the other in time. In milliseconds, this happened like that. But poor spatial resolution. So it cannot locate specific brain regions involved. It's very general what happens to the ultimately electrical activity in the entire cortex that is being recorded in EEG. So it gives temporal resolution. While the other tool is fMRI, functional MRI, it offers high spatial resolution and enabling us to precisely locate the brain activity, where in the brain the activity is taking place. So location can be precisely found out because it involves spatial resolution, but it do not give that sequential temporal resolution, and it requires subject to remain still inside the noisy and confined scanner, which may distract the neural meditative state. So person in that tube, in an MRI tube, there is a lot of noise going on and confined environment, and then doing meditation in that. So that it becomes a challenge many times. So these are the limitations, but this is the benefit of this particular tool. And the third important tool is PET scan, positron emission tomography. It is valuable for measuring metabolic changes, and it measures the local blood flow changes. So that also give spatial resolution, कहाँ पर ये blood flow increase हो रहा है, part of the brain, but there is low temporal resolution of this technique also, and it involves use of radioactive tracers, making repeated studies less ideal for long-term meditation research, because in the same subject repeatedly it requires that radioactive elements injection in the body. So that may be a limitation. It is harmful. We cannot give repeatedly to the same person. So there are limitations and benefit of each one of these tools. And a combined approach of these methods allow us to build a more comprehensive understanding of how meditation shape brain structure and function over time. All the three tools are generally utilized. Now, first we look at the process of mindfulness meditation. Many of you might be doing mindfulness. In fact, I have never learned and I never did actually the way in which it is being taught and practiced. But I know about it theoretically many things. But I have read, I have not first-hand experience of practicing mindfulness meditation, but many of you might be practicing also. So here, um, three things we are going to see in the process of mindfulness. These are the inner circle shows the experiences. So as an individual, when I do meditation, So what I experience, so experientially, the person is focusing on the object. Object may be this sensation of a breath going in and coming out, or maybe any other sensation in the body, or maybe thought, maybe feeling. So focusing on something, but then the mind starts wandering. So when we start focusing, we see that the mind is wandering somewhere else. Initially, we may not be aware of that wandering also. After a while, we become aware. We recognize that, oh, it is wandering. So recognizing that. And when we recognize, it is suggested in mindfulness training that you let go. You don't fight with the thoughts, let them come and go, something like that. Or they say gently bring back the mind to the breathing or to the sensation. So without fighting. So that is letting go. And letting go and then return to the object. Object means breathing or sensation or feeling wherever we wanted to. So bringing it back and then remaining focused on that. And then again, there may be distraction, and again, we recognize the distraction and then we let go and then we shift back and continue focusing. So this goes on happening in meditation. In any kind of meditation, generally, this cycle goes on. What are the attentional processes happening? This is sustaining of attention. Then there is distraction. This is monitoring. There is a part of brain which is monitoring that yes, some distraction has happens. It is not sustained on the particular object. And then disengagement from this distracting thought, and then shifting back to the object, and then sustaining. So these are the attentional processes which are happening. There are different neuronal circuits, neuronal networks, which have been found responsible or correlated with all these 5 stages. There is a alerting network, there is default mode network, there is salience network, executive network, and orienting network. So different neuronal networks are associated with these experiences or these attentional processes. So let us explore these 5 kind of neuronal circuits or neuronal networks. The first thing is attention regulation. Researchers have consistently documented heightened attention in meditation practitioners. The neural process involved in attention regulation involve actually three processes: alerting system, orienting system, and executive control system. So in attention regulation, three neurological systems are involved: alerting, orienting, and executive control neuronal circuits or the network. Alerting system include reticular activating system of brainstem and thalamus, both. This is more general and this is more specific, but some of the thalamic nuclei also are involved in general awareness. So that is the first part in alerting system. Second is locus coeruleus, which is also part of midbrain, and then frontal and parietal areas of the brain. Orienting system includes superior colliculi, pulvinar nucleus, ventrolateral PFC, prefrontal cortex, and frontal eye fields. While executive control system include anterior cingulate cortex, dorsolateral PFC, DLPFC, and basal ganglia. So these are the structures involved in these 3 systems, and activation of these 3 systems will help the person detect and respond to external stimuli objectively without emotion affecting the judgment. So these are the three systems which are activated during meditation. So let us see these systems. The first is alerting system, the basic attention system in the brain responsible for general arousal and readiness to respond to stimuli. It prepares the body and mind to react to incoming stimuli. So it is vital for survival and performance of any activity. When we look at the neural mechanism of alerting system, Nidhi, just look into, there is somebody's microphone. Tonic alerting and phasic alerting. Tonic alerting system is the brainstem and thalamic reticular activating system, which establish a basic level of wakefulness, basic wakefulness level. But then there is phasic alerting. Phasic alerting, like before we started this talk, we were all in the wakeful state, but now our mind is focusing on what I am talking. So this is stimulus-driven alertness, detection of something new or something important in the environment. So just now there are so many other input might be coming, some sounds or some scene, but then we are not paying attention to them, paying attention to what is being talked here. So this is important. So while doing meditation, the person want to put attention on the breathing or on other sensation or thought. So that is important input where the person is able to put the awareness or attention. So when it is detected, then locus coeruleus release norepinephrine, and that will activate the frontal and parietal regions, which will boost the alertness and sustaining of the focus. So the sustaining of the focus while doing meditation, the important part involved is locus coeruleus and frontal and parietal cortex. There are several references for this. I was wondering, a lot of work has been done between 2010 and 2025 on neurological correlates of meditation, especially this mindfulness meditation. So another system is orienting system. The orienting network is a brain system that prioritize information across sensory modalities and space, and is responsible for directing attention towards relevant stimuli. It controls attention shifting towards stimuli and sustains attention on selected object or event. If we look at the neurological component, posterior parietal region, largely on the right hemisphere, that is responsible for this orienting system. Then frontal eye fields and pulvinar nucleus of thalamus, which is involved in disengaging attention and engaging with the target. So when the distraction is noticed, disengaging with that distraction and engaging again with the object, that is done by pulvinar nucleus of the thalamus. And even superior colliculus is playing a role in this system, orienting system. The orienting system has got these parts there. They seem to be related with this activity of orienting system. And there are some references for that. The third is executive control system, or it is known as central executive network, CEN. Central executive network is a set of interconnected brain regions that facilitate goal-directed behavior and cognitive control. It manages higher level functions such as complex problem solving, decision making, error detection, and attention dependent tasks. So this is what we utilize, like just now while we are talking or while we are doing any intellectual work. Uh, it acts as CEO for conscious and self-directed actions, allowing a person to plan, organize, and achieve goals by controlling behavior. A stronger CEN is associated with greater resilience to mental health symptoms. And this is the uniqueness of human. This prefrontal cortex, key component of this network, phylogenetically, it develops late. So it is not there in the lower animals. And as the evolution take place, gradually it started developing. So it has developed late in the all other compared to other brain structures, and it is fully or most developed in human beings. So it is larger in human beings, distinguishing our cognitive capabilities from the other animals. Other animals don't have this much cognitive capabilities. We possess this because of this, especially the prefrontal cortex. Now, looking at the structures which are involved in this control system, one which is very important is dorsolateral prefrontal cortex, DLPFC. It is highly active during conscious interruption and decision making, contributing to cognitive control. We have talked about it in connection with hypnosis and how the hypnotic suggestion or irrational to rational belief, how there is a switch over. There also, I explained you this DLPFC. Then anterior cingulate cortex is also equally important. It is involved in error detection. So I wanted to focus here. Mind is distracted here. So there is error between the two. And that detection of the error is done by ACC, conflict resolution and monitoring. It exhibits increased activity in meditators, helping in selective attention and reducing distraction. And posterior parietal cortex, which is associated with awareness of the self, and it helps integrate information to guide actions. Experiences are happening with me, with I. So it is a self-focused cognition, a posterior parietal cortex. And then medial part of the frontal cortex, it works with DLPFC and SCC to support executive functions. So these are various structures are included in this executive control system. And there are large number of references on that. And then two other networks. These three networks are involved in attention system, but the fourth one is default mode network. It is a network of brain regions that becomes more active during rest when we are not doing any work when we are at rest and when the brain is not focused on the external world, but rather it is engaged in internal thought process like daydreaming, reflecting upon the past, planning regarding the future, social cognition. So when this kind of thing is going on, or when nothing, we are not doing anything, but some stray thoughts, random thoughts keep coming and going. So these random thoughts, they are due to the default mode network. It is thought to play a crucial role in self-awareness, memory, and understanding others' perspective. These are some of the very initial findings regarding default mode network. This network deactivates while focusing on an externally demanding task. So when we decide to focus attention somewhere, this network stops. Just now, while you are attending to some activity of default mode, so some other thought pops up, and then we bring back the attention to where we want. The neural mechanisms, while the exact structures are still debated, the DMN is known, DMN is known to include medial prefrontal cortex. So for cognitive action planning, etc., it is dorsolateral prefrontal cortex. This is medial part of the prefrontal cortex, and that is involved in self-referential thinking and future-oriented thoughts. Posterior cingulate cortex, that was anterior cingulate cortex, ACC, this is PCC. It is crucial for episodic memory retrieval and future planning. Angular gyrus and other lateral parietal region, they are involved in social inferences and integrating information. So these are the three structures involved in default mode network. While salience network, salience describes things that stands out and capture our attention. For example, a red dot among white dots. So it catches our attention. A loud noise in a quiet environment. So something which is distracting or something which is dominant, different from the total environment. So our mind is attending to that, and that is a salient network. The salient network is responsible for detecting salience, means it identifies novel, emotionally charged, or behaviorally relevant stimuli. We have decided to focus on the breathing, then salience network helps in doing that, because that is the relevant stimuli while I'm doing meditation. So that switching and control, it directs attentional and working memory resources when a salient event occurs. Interoception, it integrates internal body signals with external information. Internal body signals means, we sense the sensation from inside our body. We sense sometimes something happening in the stomach, gurgling and all, or we sense the inflation and deflation of the lungs with the breathing. So they are internal sensations, interoceptions, emotional and body awareness. It processes emotional stimuli and contributes to awareness of the body state. With emotions, the body state changes, so that link perhaps is through salience network. Behavioral guidance. It facilitates appropriate behavioral responses by influencing the central executive network. It influences central executive network, so that wherever we wanted to put attention, there we are able to put. So salient network, it detects and then conveys to the central executive network. The neural mechanism salient network include medial prefrontal cortex, which is involved in self-referential thinking and future-oriented thoughts. It is involved in default mode also, and here also. Then anterior insula, it integrates interoceptive signals and coordinates with other brain network. And dorsal anterior cingulate cortex, it works with insula to integrate signals and trigger appropriate motor responses. So again, coming back to what we had started with, the experience cycle. And this is the cycle of attentional process, sustaining attention, distraction, monitoring, disengaging, and shifting. And the neural network, as we have seen, alerting network is working when we are doing meditation, but then the default mode network, which gives distracting thought, then salience network will identify that, it extends out, so it will identify that, and it will give to executive, so they'll be disengaging, and the orienting network will shift it back to the focus, to the object. So like that, cyclically, these 5 different networks work while we are doing meditation. And gradually, the distracting thoughts recede with the practice, so the mind remains focused on the object consistently for a longer period of time. So we have understood some neurological correlate of mindfulness meditation process. And now, if we go on to the benefits of mindfulness practice and neurological correlate of them. So there are 4 mechanisms indicated, which are involved in benefits of mindfulness meditation. First is attention regulation, about which we talked by now. Then second is body awareness. Third is emotion regulation. And fourth is transformed self-perspective. What we believe about ourselves, what is our perspective about self, that is transformed. So let us think about these 3 now. This we have already talked. So body awareness is the conscious perception of body's position, movement, and sensations, encompassing both internal, that is interoception, and external, that is proprioception information. Proprioception information means what is the position of my body parts. Just now my knee joints are flexed, or my left elbow is flexed and right elbow is straight, or whatever. That information continuously is provided. That is proprioceptive, and interoceptive is from the inside organs. Neural mechanism, important structure for body awareness is insula. Insula plays key role in body awareness and is involved in introspection and attention. An insular gray matter volume is proportional with accuracy of the meditative practice. So as the person is doing meditation regularly and more perfectly, the person is able to do for longer period, the gray matter volume in insula increases. That is found out by PET scan. More blood flow is going to that. So it plays an important role there. Insula in temporoparietal junction gets activated also in social cognition and empathic responses. So there is a link between these two also, as a person does meditation regularly, the empathy increases, and relating with the people will become more healthy. Okay, so various references for that, and then emotion regulation. That is third thing. Mindfulness, recognition of emotion, observing them without attachment or aversion. So what is the feeling right now in my mind? Instead of I am angry, there is anger. Or instead of I am worried, there is worry in my mind. Hmm? Instead of I am frightened, there is fear in my mind. So observing the state of mind, observing them without attachment or without aversion. There is happiness in my mind, whatever, positive or negative. By acknowledging and naming the emotions, one fosters greater awareness, balance, and inner peace. So this little change, which we talked in ego purification, and then Panchakosha also we have discussed that when we adopt that objective thinking process from the subjective, then we are detached from the emotion. The I amness is detached from the emotion. So there is anger in my mind. That is, I am able to sense that. So that itself will bring about greater awareness, balance, and inner peace. Mindfulness meditation practice will not eradicate emotions. Instead, the person will get better control over the emotions by mobilizing valuable mental resources, ultimately mitigating the destructive consequences of emotional reactions on themselves and on others. So emotions are felt, but then before acting, the emotions are um, handled and the actions are guided by intellect rather than emotion. So it will mitigate the destructive consequences of emotional reactions. Neural mechanism, neuroimaging studies have indicated that mindfulness meditation modifies emotional regulation through changes in different structures, like there is increased engagement in lateral frontal regions, which supports executive function such as attention control and mental adaptability, that lateral PFC, dorsolateral PFC and all. Then modulation of anterior and posterior cortical midline structures such as medial PFC and cingulate cortex that improves self-awareness and emotional regulation. Then left amygdala gets down-regulated during emotional processing in beginner meditators and is associated with decreased stress and heightened emotional resilience, resulting reduced symptoms of anxiety, depression, and stress. So it has a lot of implication in all these conditions, anxiety, depression, and stress. Um, Left amygdala is giving emotional significance to the thoughts or to the external situation. So there it emotional um, importance is reduced, and that's how the anxiety, depression, stress will be managed. The dorsolateral PFC, DLPFC is also involved in control of regulation of valency of emotional experiences, while the ventromedial PFC might be involved in extinction of arousal caused by emotional stimuli. So both will happen. And the final fourth thing is transformed self-perspective. Buddhist philosophy describes the self as just a creation of mind. So it is different from Vedantic perspective. And there it is consciousness is the self and like that. So here in Buddhist philosophy, they describe self also as a creation of mind. Like in neurology also, consciousness is considered to be the creation of mind, uh, uh, functioning of the brain. So we are influenced by five changing processes. That is what is proposed in Buddhist philosophy. There are five changing processes. One is the process of physical body, physical body, which grows and becomes old and then dies and like that. Then of feelings. So feelings also, they emerge and they settle down. So at times I'm happy and then the happiness goes away. There may be sadness or there may be tension. So they come and go. Nothing remains permanent. Of perceptions, I perceive maybe some itching here, but if I don't do anything, it goes away. So perceptions keep coming and going. We see some scene and that scene keeps on changing. Then responses also keeps on changing, the process of responses and the process of the flow of consciousness that experiences all these things. So I am experiencing body, feelings, perceptions, responses, so that I am, that itself is also uh, not a permanent thing. It is changing. So what they say that identifying any one of these as a static self is the cause of suffering. So knowing that all these things are going to change, these also will pass, they say. So whatever situation has come or feelings or bodily issues have come, they come and they are going to go away. And even the I who is experiencing this also is ever changing. Um, that kind of perspective of self. Mindful perspective of self enhances cognitive flexibility. It will enhance cognitive flexibility. So, ability to adapt, adjust, and reorganize thoughts, emotions, and behavior in response to changing circumstances. It will give that ability. Cognitive flexibility can help one to improve decision making by considering diverse perspectives and having open mind to alternatives. It enhances creativity by flexibly connecting the dots. So enhances creativity and better manage stress and everyday challenges by adapting to given situation. So resilience. So these are the benefits associated with change in the self perspective about self. Neural mechanism involved are mindfulness practice increase the activity in brain regions associated with self-awareness, such as insula and medial prefrontal cortex. Clinical application in between also I talked that it is useful in depression and anxiety and all. According to Buddhist philosophy, chronically tormented mind is the reason behind all negative effects on the health and can also cause somatic disorders. Objective awareness allows one to interpret emerging thoughts as the spontaneous activity of the mind and prevents experiencing it irrationally as fact. The thought come and go. So if person is doing regularly meditation, uh, irrational thoughts are they just vanish, they just melt because they can see that the thoughts are coming and they are going. Just now I have this kind of thought regarding a person or a situation. Next moment it is going to change. Nothing is going to remain permanent. Mindfulness meditation has clinical implications for disorders such as ADHD and bipolar disorders. This also have been shown by different people. And now we finally talk about limitations and recommendations for further research. Most of the studies include narrow population sample, such as Western demography or person without mental illness or some particular mental illness only. So studies in diverse population analysis could provide further insight into the unique benefits of mindfulness practices. So a lot of work is yet to be done on this. Then the another limitation, the extent to which anatomical changes in brain affect emotional regulation is not completely understood. So we are able to understand that these are the structures playing a role, but what exact role they are playing and how they are playing that role, all those things are yet to be found out. The extent to which continuation and discontinuation of practice of meditation and how much they have impact on emotional regulation is still to be explored. And there is lack of standardization among various methods. So it makes it's very challenging to compare findings across studies. So every individual who worked, they adopted some of their own method. So methodological standardization is yet to be done. And many investigations have focused exclusively on either mindfulness meditation or cognitive flexibility, neglecting their potential interplay and their effect in neural circuit. So more that kind of studies are required. It is also unclear whether the neurophysiological changes are the outcome of mindfulness practice or they are simply the result of socio-psychological factors like decreased stress, improved relaxation, and motivation. So it is like that whether the neurophysiological changes took place and therefore there is more relaxed and more comfortable state of mind, or because of meditation there is relaxation and that causes this neurophysiological changes. So it is cause and effect relationship also is to be established. So therefore we say okay, these are the neurological correlates of whatever is experienced. What is first and what next is that is probably it is both are same when neurologists talk about it is neurophysiology first. When psychologists talk, it is the psychological things first and leading to neurological changes perhaps. A comparable control or pre-test data can improve the comparison, especially with single or double-blind trials. So this kind of study design is needed, pre and post with double-blind. So there are some
Who was the study?
limitations. And finally, I conclude with a prayer. You know, we all, our journey for the enlightenment, whether we know or not, when we are born as human being, the scriptures say that we are going ahead in the journey of having that permanent, absolute, and independent happiness, nitya nirbhel or nirmit sukh. So, वो journey में let us all keep on progressing. Let our journey continue. With that prayer, I thank all of you. Thank you very much. So this is what was very interesting and fascinating for me to read about and thought of sharing with you. I don't know how much I could convey, but uh, learning continues. Thank you. Thank you very much. Over to you, Niti, now.
Yes, sir. Thank you so much, sir. We always get to learn something new when we are in your company. And I'm sure all the audience members must have enjoyed today's presentation. And we invite now if we have any questions or any feedback to share.
Right.
I have one minute.
Questions, though, I don't know how much I'll be able to handle, but yes, your comments, some of you might be aware of some different things also. And some of you are practicing, so maybe your experiences and sharing will be more important for me. Please, anybody?
Please raise your hands and then we'll take one by one. Deepa ma'am, you want to say something?
Yes, please.
मीना जी, yeah.
हाँ.
मीना जी प्लीज, आप अपने आप को अनम्यूट कर लीजिए मैम प्लीज.
Yes, नमस्ते मीना जी.
नमस्कार सर, नमस्कार.
नमस्कार. Please.
एक्सेलेंट प्रेजेंटेशन सर. हमारे पास तो वर्ड्स नहीं है, पर इतना सुंदर आपने बताया कि न्यूरोफिजियोलॉजिकल चेंजेस ड्यूरिंग मेडिटेशन. हमने तो सिर्फ मेडिटेशन ही किया है और उसके बेनिफिट्स ही पाए हैं, पर अंदर क्या चेंजेस होती है आज आपने प्रेजेंट किया.
आई वुड से कि मैंने तो खाली न्यूरोफिजियोलॉजी बताया है, आप लोग तो मेडिटेशन करते हो. दैट इज ग्रेटर देन दिस एक्चुअली. एनीवे, थैंक यू. थैंक यू
और
फॉर योर.
अभी जो हम जो मेडिटेशन कर रहे हैं, समर्पण मेडिटेशन, तो अभी तक जो हमारा समय, जैसे मोबाइल में काफी चेंजेस आ गए हैं ना, हमारे एडवांस मोबाइल जो आ गए, एक साथ हम कॉन्फ्रेंस कॉल कर सकते हैं, सबको देख सकते हैं, बातें कर सकते हैं. तो सेम गुरु तत्व में भी चेंजेस आ गए. पहले का जो समय था तो एक गुरु एक शिष्य को ही आत्म साक्षात्कार करा सकते थे, ये आत्मज्ञान दे सकते थे. पर अभी जो समय आया है कि गुरु के सिर्फ फोटो मात्रा से या ऑडियो वीडियो मात्रा से भी हम सेल्फ रियलाइजेशन कर सकते हैं, आत्म साक्षात्कार पा सकते हैं. और ये मेरा खुद का भी बहुत अच्छा एक्सपीरियंस रहा है कि मैंने सिर्फ वीडियो कॉन्फ्रेंस से ही मैंने अंदर से नाभि में से ओम की आवाज बहुत अच्छी तरह सुनी थी. तो अभी जो मैं समर्पण मेडिटेशन में हूँ ना, वो क्या है कि पहले के समय में सिर्फ आज्ञा चक्र से ही स्टार्ट होता था ज्ञान. हमारा जो ध्यान है, जैसे आर्ट ऑफ लिविंग है या ब्रह्मा कुमारी है या राधा स्वामी है, जो भी मेडिटेशन थे वो सब आज्ञा चक्र से ही स्टार्ट होते थे. और हमारे जो गुरु जी है वो बोल रहे हैं कि गुरु तत्व अभी इतना एडवांस हो गया है कि सीधा सहस्त्रार से ही स्टार्ट होता है. तो जो समर्पण मेडिटेशन है वो सिर्फ सहस्त्रार पे चित्त एकाग्र करके बैठना ही है, और फिर जो होता है वो गुरु कृपा में घटना घटित हो जाती है कि हम जो सूक्ष्म में ऊपर भी जाते हैं या आउट ऑफ बॉडी एक्सपीरियंस करते हैं या थर्ड आई से भी हम जो एक्सपीरियंस करते हैं. वंडरफुल एक्सपीरियंसेस of so many friends and family members, especially from my daughter also. हम 10 दिन पहले ही बद्रीनाथ जाके आए. तो बद्रीनाथ से आगे जो चरण पादुका है ना, नारायण पर्वत के ऊपर, वहां सिद्ध लोग बोलते हैं, जो पांडव लोग ने
मीना जी, वेरी नाइस. आपके एक्सपीरियंसेस वगैरह सुन के बड़ा अच्छा लगा. एंड इसमें ऐसा है कि वॉट एवर सिस्टम ऑफ मेडिटेशन यू आर प्रैक्टिसिंग, you need to practice something with that faith, then it works. Whether you start with Sahasrar or here, and all those things are fine. If somebody is following that, one may find it something very interesting, very useful. But then instead of comparing that this is better than that,
I am not comparing, just अभी जो
every
हो गया
system.
एडवांस वो बता रही हूँ.
No, you are not comparing, but what I am telling my thoughts, that yes, every system is really wonderful, and whatever is your faith, accordingly you do, and doing it will have the same effect on everybody.
Yes.
Wonderful. Thank you very much for sharing your thoughts.
अरे आपने जो बताया फेथ, तो मैंने जो फर्स्ट हमारा डॉक्टर कॉन्फ्रेंस अटेंड किया था उसमें तो मुझे कोई फेथ ही नहीं था. जस्ट मैं तो ऑब्जर्व और क्यूरियोसिटी से ही गई थी. पर नाभि चक्र से लेके सहस्त्रार चक्र की सब एक्सपीरियंस मुझे वही कॉन्फ्रेंस मिल गया.
बहुत अच्छी बात.
तो बाद में मुझे फेथ हुआ. तो एक गुरु कृपा ही होता है कि आपके जैसे गुरु मिलते हैं तो हमें
डेफिनेटली
बस धन्य हो गए सर.
आई
नमस्कार.
थैंक यू. नमस्कार मीना जी. यस, शिखा बताइए.
नमस्कार सर.
नमस्कार
सर, आपको देख के, आपकी बातें सुन के ही इतना ज्यादा मोटिवेशन हो जाता है मुझे मेडिटेशन की जरूरत नहीं लगती फिर। आप
I don't.
हमारे गुरु हो के आप अभी भी ये कह रहे हैं, और इतना हम्बली कि अभी इट इज learning goes on and you're so humble about it. I mean, I have no words, sir.
I don't know what is this known as, but yes, learning goes on. I'm learning like all of you. And whatever I have already shared. जो भी नया नया जानता हूँ आपके साथ शेयर कर रहा हूँ एंड आपसे लर्न कर रहा हूँ. दैट इज द प्रोसेस. अच्छा लगता
Uh,
है. थैंक यू.
Thank you so much, sir, for your efforts. And also, sir, ये थोड़ा सा मैंने इनिशियल का मिस कर दिया था, तो आई विल हैव टू गो थ्रू द रिकॉर्डिंग अगेन, एंड उसके बाद अगर कुछ होगा तो आई डेफिनेटली आस्क यू, सर.
प्लीज, यू आर मोस्ट वेलकम. ओके.
थैंक यू सो मच,
थैंक
सर.
यू. थैंक यू. बाय. ऑल द बेस्ट.
थैंक यू,
Right.
सर.
There
So,
was this suggestion, Nidhi,
Anji,
suggestion था किसी का
I'll
कि
just
मैं
read it out.
मेडिटेशन करवाऊं, लेकिन आज टाइम नहीं है. मुझे नहीं लगता है. इट इज ऑलरेडी 9:55. प्लीज, यू कैन वाइंड अप नाउ. या.
Sir, I just wanted to ask one question. When you were telling about those 5 stages, focus on object, then mind wanders, and then we recognize that, and then we let go, and then we return to the object. Sometimes what happens when we are focusing on, it is my experience, when I focus on objects, sometimes it is breathing, and sometimes I visualize something. For example, light or maybe some date. And so my question is, what I am describing, is it considered wandering of mind, or is it just how it happens naturally? So sometimes the picture starts to, कुछ कहानी बन जाती है उसकी, like that deity is moving, blessing, this. So that is wandering of mind.
It depends upon you. How do you perceive it? If you perceive कि ओ मैं तो ये करना चाहती थी, ये यहाँ कहाँ आ गई. If you perceive it like that, it was wandering.
Okay.
But if your mind is flowing along with that, so it is just change of object. Object was breathing, then the next object on which mind is focusing is that image, then whatever next image. So if you find it to be distraction for you, then it is a distraction. And otherwise, it is a flow if you accept it. So therefore, only know that Ericksonian method, they say, okay, accept that also and utilize that. So utilizing that, even the distraction, even mind distract due to sound, then we think that, okay, my mind is attending to the sound and I'm doing meditation. So you don't get perturbed with that. Then it is the process. That is how I understand it.
Yes, sir. Yes, sir. Thank
It is all upon your subjective perception
you. Yeah.
about that, what has changed, like
Yes,
that.
I got it. Okay. Thank you, sir.
Because इसीलिए तो ये है ना कि this area, doing research in this area is really very, very challenging. Because everybody's perception now, the same thing may be distraction for one and no distraction for other. And in both of them, the neurological correlates will be changing. So understanding and theorizing the neurological mechanism of meditation is really very challenging. ना काफी कुछ चेंजेस हो रहा है. ये अभी हम न्यूरोकेमिस्ट्री में गए नहीं, बट न्यूरोकेमिकल और जो न्यूरोपेप्टाइड वगैरह का जो है, देयर इट इज रियली वेरी वेरी कॉम्प्लेक्स. बिकॉज एक छोटा सा एग्जांपल मेरे माइंड में आता है, दिस विल बी इंटरेस्टिंग फॉर मेनी ऑफ यू. से neurotransmitter, say for example acetylcholine. So when acetylcholine is given to any animal or human being, it will reduce heart rate. And when norepinephrine is given, it will increase heart rate. Every animal, every human being will give the same response. but some neuropeptide, if you think of some particular neuropeptide, that neuropeptide given to one person and another person, there may be very different action on both because it is not a single chemical. It is the relative concentration of all other chemicals. In that sense, it is to be considered. So a particular neuropeptide may increase heartbeat in me, but it will decrease heartbeat in somebody else. Or in me also, when I'm in a particular mental state, it will increase. When my thoughts changes, it may decrease my heart rate. So we cannot say that this neuropeptide will have this influence like that. So it is a combined effect of all the those hundreds or thousands of neurochemical substances and their relative concentration. So the things become so very complex to understand and theorize and do research or standardize. But then the scientists are after this, so that is also something interesting. And this is neuroelectrophysiology, what we are talking. And there's similarly neurochemical studies are going on, a lot of things, which are more complex actually. But they are more spatial. They cannot give temporal information. Electrophysiology can give temporal information also. So yes, the science is unfolding. Okay. Thank you. So we can wind up now. Yeah.
So thank you so much, sir, for the beautiful presentation today. And thank you everyone for joining us, and we'll meet next month with a new case study. And if any one of you is interested to present any case, please do contact either me or Nivedita. And next month we'll have a new presentation.
Please come forward. Please come forward for the presentations of interesting cases and whatever you read, something new, everything, you're welcome. एक